Hello, my name is Tanuja, and for my 20% project, I decided to focus on generational health diseases. As much as I want to focus on all of the health diseases, I decided to focus on high cholesterol. I decided to focus on high cholesterol because it's one of the most common health diseases people have, and it's also because my dad has it. My dad specifically has a thing called familial hypercholesterolemia, which I will be talking more in depth about later. So high cholesterol has limited him from eating certain foods such as fried foods and foods that have saturated in trans fat. And with that being said, I will be focusing on the eating pillar from the pillars of health. So what is high cholesterol? It's a waxy substance found in the blood in which your liver makes to protect nerves and to make cell tissue and certain hormones, which can also be dangerous because it can build up on the artery walls. So I learned a lot of things throughout the process of my project. Cholesterol is carried through your blood attached to proteins. So this combination of proteins and cholesterol is called lipoprotein. So there are two main forms of cholesterol. The first is LDL cholesterol, which stands for low density cholesterol, which is often called bad cholesterol. It's considered unhealthy to have high levels of LDL cholesterol in your body, which is the bad ones. The other is the HDL cholesterol, which stands for high density lipoprotein. And it's sometimes referred to as good cholesterol. So higher levels of HDL cholesterol, the good ones, can be a good sign of good health, basically. So as you can see on the bottom left image, the bad cholesterol, the yellow ones, the yellow circles builds up, blocking the good cholesterols to flow efficiently. And if that blocks fully, you are more likely to get a heart disease or to die from a heart attack. And to remember, you have to remember that even young children can have bad cholesterol. So it's much more common for people who are over 40. So as you age, your liver becomes less able to remove LDL cholesterol, the bad ones. Also, so I've decided to focus more in depth in high cholesterol, which has something to do with my dad. Familial hypercholesterolemia, which is a form of inherited high cholesterol. Having a genetic risk for high cholesterol doesn't guarantee that you'll have high cholesterol. It just means that you have an increased risk, and which means I have a higher chance of getting LDL cholesterol since my dad inherited from his dad. So high cholesterol can be inherited, but it's often the result of unhealthy lifestyle choices, which makes it preventable and treatable. But since I'm focusing on the familial side, I will be talking about the prevention in that specified topic instead. So to start it off, cholesterol doesn't give symptoms. If anything, asking a doctor is probably your best option. So people with FH, familial hypercholesterolemia, can't control their cholesterol levels through diet and exercise alone. So they may need to use prescribed medications as well, which is what my dad does daily. And one fact is to prevent heart disease, saturated fat can be limited to less than 10% of calories per day. So a combination of both reducing consumption of saturated and trans fat, as well as an increase and exercise is needed to reduce cholesterol successfully and delay the onset of heart disease, heart attack, and other complications as well. So people who have familial versions will generally have much higher cholesterol levels as well as heart disease at a very younger age, which is why eating healthy early in life will be beneficial. And my dad having this has given me motivation to eat healthier because I don't want to continue this generational trend of passing down these diseases because I don't want it to be a burden to my future families. So even if you are sure you don't have high cholesterol or any other type of diseases, these factors can always affect your body and might change that. So some questions to ask yourself is, are you aware of the unhealthy foods you eat but still eat it? How easy or difficult do you think it is to stop eating foods that include saturated or trans fat? Do you have family members who have generational health diseases that are passed down? If so, what are you doing to prevent them? So yeah, thank you for watching.